So I have the honor to introduce our closing keynote speaker. And actually, don't leave right after he talks because Tom Meehan has a couple of awards to present afterwards. So we'll make sure that you're all still here. I have Kevin's bio to read. What's not in this bio is that actually Kevin is no stranger to Connecticut. Actually, we go way back, as you know, with some of us in the room. He was on our board of eHealth Connecticut way back when we were, in the first iteration of the HIE days, sort of here in Connecticut many, many years ago, and was a physician in Waterbury and actually worked sort of in the Connecticut system for many years. But right now, he is the Chief Executive Officer of the National Coordination Center and its supporting shared services entity in Washington, ADARA, in Washington, D.C. The National Coordination Center is a collective of public and private sector advisors who lever the advantages of partnership and collaboration to solve complex health issues. The National Coordination Center is built on the premise that individuals can maximize their positive effect on the healthcare industry when they work together on large transformations within an enterprise or across enterprises. The NCC reinvests profits from the projects it supports into mission-focused priorities for its clients. NCC is implementing a minority medical informatics internship for U.S. veterans in collaboration with Cerner Corporation of North Kansas City, Missouri. So I'll let Kevin talk all about it. He knows more about it than I do, so welcome, Kevin.
Well, I think I'm done. I think I'm done. That was pretty much it. But no, I appreciate you taking the time to spend with me. I think I only have 2.5 hours left for the, before we cut. Is it 2 or 3? But I think we should. I'll go through really quickly. I mean, I want to hit some of the high points of what we're doing with the NCC, but for the most part, I really, want this to be an introduction of the organization and the collaboration opportunities to you guys to, potentially get involved in some way in some of the projects that we're doing, or to identify additional opportunities for us all to, make change in the healthcare system together. And so I really want to spend at least a little bit of our time together, doing question and answering. So, at the end of the day, it's always good to kind of cleanse your palate, with something that's really, really happy, right? So this is our happy slide. So we have new interns that just recently started, as mentioned earlier, that, you look at them and you're like, they're all happy, right? They're all young. They're all going to make a difference in the world, right? And so this is, part of what, like it's really reinvigorating, I think, to most of us. And I know that, there are other interns here in the audience as well. And so it's just really nice to, be part of something that is bringing youth into, helping to solve healthcare problems as well. So I just wanted to kick off with, some of the background of, why we started the NCC in the first place. And it really kind of, started. We're all kind of a victim and beneficiary of the experiences that we've had in our lives, right? So they shape, what you do going forward. So, all of our personal experiences turn into how we manage, people within our jobs, how we interact, on a person level to other individuals within our organization. So I wanted to share a few of these examples of transformation projects that I'd worked on in the past, and because they start shedding the light on, why we thought that the NCC was really important to build in the first place. So the one on the left-hand side is the London Program for Health IT. And so for people that are here in the room, you may, it was like always in the press, a while back. It's less in the press now, but large Cerner implementation that was, really focused on being able to connect organizations across the different hospitals within the London geography and then connect into a spine nationally within the UK. One of the challenges that they ran into was that, they didn't really, especially early on, it was really focused on building IT infrastructure. So there was a prime contractor that was, a telecommunications, vendor that, was saying, hey, this is like the dial tone of healthcare, right? So you just plug it all in, everybody picks up the phone and starts, punching in on the keys, and all the data is going to be moving between the different organizations, and why is this so hard? But at the core, whenever they really addressed, the dial tone of healthcare for the UK, from a telecommunications perspective, it turned into an unusable system back on the front end, as the providers were trying to enter in data into the system. And so key lesson learned was really to engage the clinicians early and not just focus just on the IT infrastructure, but the clinical workflow that was really going to be driving systemic change across such a large geography. This particular one, we actually learned from that, and at the VA today, there are a number of councils that are in place, and some of the people that are here in the room are participating in some of those enterprise councils that help to drive, standardized workflow, and they have heavy clinician involvement. So you can learn from your mistakes, right? You're out there, you're doing something, you see it, it's wrong. You bring it to the next, project that you're working on, and then you have stories to tell, like, I'm telling you, you really have to do this. Look over there, right? And then the next one was a similar instance where, the vendor didn't necessarily have the content knowledge. It was a non-healthcare organization going into the healthcare setting. And so the challenge that they would run into is they had, multi-million-dollar budget, but then whenever it got down to the small things, like, this little widget is like, $10,000, they didn't have the content knowledge to know, I need to really buy that $10,000 thing, because if I don't, then I'm going to lose out on this $20 million overall project, and the overall project's going to fail. So bringing that content knowledge, to the table is really, really important. So if you're in the first, project, content knowledge is really important, right? Second, content knowledge is really important. And then the last one is, a similar kind of theme. The organizations were really trying to work together to do a shared risk arrangement. This was, 2 large brands in Texas that, were coming together to form a accountable care organization. And, the key there was bring that content knowledge together and then build a capability model that would be able to support it across the organizations, and then be really clear as to who does what in the model, because that's the hardest thing, is everybody knows we got to do a lot of things, but nobody ever wants to say, I'm going to give up, responsibility for this task over here and take on responsibility over here. So, as we move forward, I was most recently working at the VA. As mentioned earlier, I was here in Connecticut, kind of was stupid enough to jump on planes for 15 years, jumping around for, in various consulting firms at, Deloitte, PwC, and Accenture. But then landed at the VA, working on a project to help improve the workflow around the referral of veterans out into the community. And so as part of that project, we had, around 100 folks that were working on the project, and made pretty significant improvements in certain geographies where we really focused to, kind of battle through and make, the referral process more streamlined. And around that same time, they were thinking about this concept of, installing an electronic medical record across all of the sites. Conversation's been going on for a long, long time, but they signed a contract with Cerner to be able to move forward. But then it was like, hey, the VA is really, really good at doing what the VA is good at, right? And they have super smart people, many people that are at academic medical centers, move across the street and, deliver care at VA medical centers. But those individuals that are delivering care, at the VA aren't necessarily the ones that are also doing, the clinical informatics work, at the larger facilities. And it's different to do an informatics project at a large facility versus a really, really small one. And so it got to the point where they were like, is it possible, to be able to create a distributed network where people are able to stay within their parent organization, continue their day job, and then be able to help and come in to support the VA and other public sector entities on a part-time basis, to be able to kind of say, hey, I'm really good at what I do. I've learned, from those past mistakes, that was similar to those past mistakes or projects that we've worked out on, on the previous slide. They're my own personal ones, but everybody else has theirs, right? Everybody in this room has experience in various projects that either went well or didn't go so well, that they could bring to the table. But they need a way to be able to inject that, in the way to be able to bring that content knowledge to the table and work as one integrated team. So the premise of the NCC was, is that possible to actually do, right? It's a really good idea, but how do you actually make that idea come to the table? And so the collaboration challenge that we were really focused on was, how do you make sure that people with complementary content knowledge, skills, and personality actually get matched together as part of a large transformation project? Because you can have one or two of those, but if you don't have all three together, like somebody has the right complementary content knowledge and skill set, but then they clash from a personality perspective, it doesn't matter, you're not going to really make any progress going forward. And the problem on large transformation projects is whenever you have a need for all three of those things to be true and for them to be complementary, it requires just a lot of people, right? And no one company sometimes has that many people, right? And many, the big secret in consulting firms, of which I've been in many of them, the larger ones, is they don't always have the right people with the right content knowledge and skills. They may have the right personalities, but it's often younger people that don't have the more mature content knowledge, and people that, some of the people here in the room wouldn't necessarily want to work at one of those larger consulting firms and kind of be in that environment. So they want to be in the environment that really made them successful in the first place and not kind of be, ripped out and, turned into a high power consulting organization type resource. And so we built a set of guiding principles as we were moving forward with, developing the concept. And one of them was, just really making sure that we work side by side with people. It was key to create an integrated approach, and we really wanted to go after people that were really, really, smart and had the right content knowledge. But at the same time, people that are really, like yourselves here in the room, are doing projects, you get pulled into a lot of different directions. So the last thing you want is to get pulled into a project, have no support. It's like a black hole of vortex of time and energy. And then you said, hey, I'm going to come in and help, but then there's no support there to be able to, make sure that you can bring your content knowledge to the table, deliver it, and then go away and come back in an ongoing basis. So that support infrastructure was really, really important to us. So, whenever you're creating something, you go back to all your friends that you've worked with in the past. And so some of the folks that are here on the screen, you probably recognize. Dr. Krumholtz is at Yale, does a lot of work on Medicare quality measure development, as well as several of the folks here in the room as well. Ed is the CEO of the Center for Medical Interoperability, and for you guys that are working on interoperability, it's probably a good thing to get to know this guy a little bit. But they have the larger health system CEOs set on the board and created the Center for Medical Interoperability to be able to connect each other, to drive, standard interoperability at scale across their organizations and then drive new standards into the market. And so they have a set of policy initiatives that they're going forward on, as well as some technical infrastructure initiatives as well. Tricia is a physician that has past chief medical officer of a couple of health plans in the past. And Dr. Freeman is the CEO of the Patient Navigation Institute, and probably one of the nicest people I've ever met in my entire life. He created the concept of patient navigation and wrote the legislation that requires patient navigation to be included in the certification process for cancer centers nationally. And so just super, super nice. So if you ever want somebody that's a patient advocate, a true patient advocate, he's the guy I would call. And so what we did is we got these folks together to say, hey, we're going to form this concept with a set of guiding principles, and we're going to create a network of people that really come together to first support the VA, and then once we create that infrastructure and network, we're going to turn that power over to support transformations at other organizations as well. And so to be able to do that, we had to start investing, and this was where all the fun comes in, right? Is setting up payroll, et cetera. But the key technologies that we had to put in place were really like around learning management, workflow, decision tracking, task and project management. So there's a lot of boring stuff that has to go in place to be able to have that support infrastructure to make sure that people can come and go. And we talked a little bit about the concept of the NCC being a low profit limited liability corporation. So for people that are here in the room, I had never actually heard of the concept before. We actually formed it, but the concept is that it was really supported pretty heavily by Bill Gates, where you have a nonprofit organization that has certain barriers and constraints of that nonprofit organization that includes how much, there's more criticism around how much people get paid, and there's a board structure that is required, for you to be able to be a nonprofit, and there's certain, uses of funds that are required. And then on the opposite extreme, there's, a for-profit entity that is, really focused on making money, right? And so our founders all came from nonprofit organizations, and they were like, the last thing we need is another nonprofit, right? We want somebody that's going to come in, and whenever we tell you to do something, you go do it. You have the agility to go out and do the work, but at the same time, we don't want you to turn this into just a money-making machine so that at the end of the day, y'all get rich, you go off and you leave us hanging. We've helped to create this organization that was supposed to support us in all of our transformation efforts, and then you leave off and cash your check and call us from Florida. And so the L3C concept requires that you do public reporting around the reinvestment activities that you do, and a certain portion of your funds have to be reinvested back into the community that you serve and the clients that you serve. So each project that we go to, as part of our project charter, is to also do a reinvestment set of activities as well. And so so when we formed the NCC, there were actually, we talked a lot about the concept of the collaboration across organizations, so people staying at their day job, so to speak, or at their home or parent organization and coming in periodically to provide the content knowledge required to be successful. But then our founders also said, hey, there's times where, I want you to just come in and provide a project manager. I don't want to go to like a steering committee and create a transformation project, that's going to change healthcare for you to help me do a strategy engagement, or, something that is, much more tactical and less strategic, and everybody in the world isn't going to care about it. But I need to be able to do that in order to support my organization. And so that's how Adira, really was born, through that process. And Adira is Italian for Ivy, and I'm probably massacring the pronunciation for Italians that are here in the room. I've been told it's Edra, but I, keep referring to it as Adira. And it was formed as a shared services entity that actually, supports all of those, really smart people that come in and out, with project management, collaboration support, et cetera. And that's where all of the collaboration tools actually sit as well. And so then we defined a set of best practice focus domains across so interoperability, patient engagement, quality. These really aligned to the founders. The organizations really came to the table to help form the NCC in the first place. Their focus areas became our focus areas to be able to push their points of view out into the market as well. And then we went out and started hiring people. And so now we actually have folks in 14 different states. So one of the key things that we really wanted to make sure was a guiding principle was that we did not want to go out and hire people within a particular location and be restricted by who was available in that particular market at that particular time. And that was really a game changer for us to be able to say, okay, instead of us thinking about who's in DC, which is a very competitive market and sometimes has its own challenges. Every market has its own challenges. And so bringing in people from across the country became extremely, extremely important. And so I'm gonna, I've talked a little bit about the NCC, but I'm gonna let you kind of hear it from some of the folks that are on our team. So we've got a short video here as well to kind of tell you why they're participating and why they're really actively involved. The video, some of them are going to be referring to a project, and so the project that we're working on right now is the implementation of the Cerner electronic medical record at the VA. And so as part of that initiative, we have around 70 plus people that have at some point come in and helped part-time or full-time on a full-time basis to, and again, I see faces in the room that are actually part of that project as well. So.
When Dr. Carr first talked to me about the NCC, I immediately said yes. It was a brilliant idea.
Having someone like the NCC or a group like the NCC recognize that my experience is valuable and can be shared with such an important project like this was very, very attractive to me, and it's just something that I wanted to be a part of.
There's a larger vision and mission to improve health and health care across the United States.
The thing that excites me most about this particular project is that I think we have the opportunity to redefine the culture in healthcare.
I think this project is the absolute best example of how we can use technology and medicine to really change the country.
Better ways that we can use data so that we can be smarter in medicine. Better ways that we can focus on what people need.
To support the reduction of burden to the clinicians. They're the ones who just say, could I just get back to the bedside? Could I just hold somebody's hand?
We're going to be making sure that we connect a large system, a lot of providers across a huge geography, making sure everybody has the right tools and the right information to connect and deliver care.
The old-time academic idea that each one of us needs to succeed in our own right, build our own teams, I think those days have gone.
I love the idea of a National Coordination Center and putting these incredible minds together for the common good. I think is incredibly powerful and motivating.
You want to be sure that the NCC is going to be run well, efficiently, that they're going to have sharp people, and that they're going to have the right values, that they're going to have the integrity and commitment to doing this for the right reasons. And it was clear to me from the beginning that this group had that.
Crossing organizational boundaries to bring brightest minds together to solve some of the most complex healthcare issues that are going on today.
I was attracted to the NCC because it's the first of its kind. It's an organization that is focused on being proactive rather than reactive.
There isn't anything else like this. This is not a consulting company. This is not a healthcare system. This is the opportunity to actually transform health and healthcare.
The NCC has that opportunity. If they can be a central organizing force that can bring to bear the necessary expertise wherever it sits in the country and put together teams that otherwise might not even know of their common interests and complementary skills, then I think they have a chance to play a very critical role in what the future may look like.
Connecting the
Brightest
minds
in
Healthcare.
We
are
stronger
Together.
So if you think you're a bright mind in healthcare, then you're welcome to join. And it was funny, I was watching Florence as she was watching this, and she's probably smiling because a lot of the people that are on here. So with that, I'm going to close out and just answer any questions that you have. There's a mic in the back.
Questions? Anyone?
All right, somebody's got to ask a question.
What's your next project? You're focused on the Cerner implementation. How wide is your net being cast?
Yeah, so that's a good question. So
can you just repeat it?
Yeah, the question was, what's the focus for the next project and how wide is the net? So one of the interesting things that's really happened is now that the network has been created, a lot of individuals have come to us and said, hey, that's an interesting network of, individuals that have the right, mission, core values, et cetera. And so we'd like to be able to leverage that in some way. So we've actually, Cerner is obviously using us, in a capacity to help provide, some additional clinical, expertise as part of their project. Another vendor has also reached out to us, that's asked to remain nameless. We've actually started doing something similar for them as well. And then we have a large retail company that has contracted with us to help do strategy. So we've, it's in both of those are large, impactful organizations that need to have a team, so a clinical team that really comes in and has the right content knowledge at the right time. So it's hard for even larger organizations to have an ophthalmologist on staff, a cardiologist on staff, a nurse that is a peri-op nurse, and all of the other 50 different types of clinicians that are out there. But they need them at specific times throughout the year. And so we become very much a shared service for them to be able to kind of tap in on as needed basis.
Hi.
I was going to pimp you. I forgot to pimp you.
Oh,
you
yeah,
got pimped
I know.
in the first.
I knew I was in trouble. So, Kevin, how do you pick and prioritize projects? Because there either could be an endless supply of them,
right?
Some at very sort of more small scale, and some of them massive, like the Cerner implementation at the VA.
Yeah.
What are you using to kind of figure that out?
I mean, so far, the process has been, if there's an individual that has either helped to form the NCC or in some way has been impactful, they gotta get top priority in the resource, and kind of if they need something, then we go find it. Like within a week, you say, hey, I need somebody that has this particular skill set, and we go out and find that particular individual. As we go forward, the mission and the impact is probably going to be the key driver. So all of our projects so far have really had pretty significant potential for impact in things that multiple people would see and hear every day. And so we want to continue going down that path as much as possible, because then if we don't, then we kind of turn into Accenture or Deloitte or something like that, right? Not to say that that's bad. I mean, there's a requirement for that in this world, but the mission focus of the organization was really critical. And things that whenever we do reinvest, then it's things that we want to reinvest. And there's somebody within the groups like, hey, I really want to do this. Then we give them the ball and let them run with it.
It's hard enough to create a team atmosphere when you have people in the same building in the same state. So how are you doing that with bringing people from all around the country with different levels of experience and interests?
This is coming from somebody that's on one of our projects, right? So, we've been very, very fortunate to have the founders be truly committed to the actual organization. So the people that were on that slide that helped to form the NCC were not people that just showed up, went to one meeting, and then they walked away. I mean, like Ed, as an example, sat on the phone with me, for hours and hours and hours trying to figure out how to set it up in the right way and bring the right resources. And each one of those organizations also seeded the organization with resources from their own organization as well. And so we have really focused on referrals as a huge part of what we do. So we took a chunk of resources from an applicant pool. So we posted positions. We got 7,000 people that applied. We went through and got our first few people on staff. And then now most of it is referrals and really letting other people choose those individuals and bring them in, and having a screening process that includes those other individuals that are on the team, because there's no way to manage it unless everybody likes each other. So like that core principle of like personality, content, and skills, like the personality fit is like critical. All right, I know y'all want to go home at some point, so I'm going to wrap up. Thank you.